Good afternoon, everyone. Our apologies for the delay. Welcome to today's update on COVID-19. With us, as always, is Dr. Deena Hinshaw, the Chief Medical Officer of Health for Alberta. Dr. Hinshaw will provide brief remarks, and then we will open the floor to questions.
Thank you, Tom, and good afternoon. Today, I'd like to provide an update on COVID-19 and the meat processing plant outbreaks in our province. First, for the general update, we have done 3,494 tests over the last 24 hours. From these, the number of confirmed cases has increased by 70 to a total of 5,963 in Alberta. 3,552 of these have now recovered from COVID-19. I am sad to report the total number of deaths has increased by 6, bringing our total to 112. Once again, I want to express my heartfelt condolences to these families. Our thoughts go out to everyone who loved these individuals and all those grieving their loss today. As of today, there have been 632 cases of COVID-19 in continuing care facilities across the province. We continue to do everything possible to protect the residents and staff at these facilities. At the Cargill facility, there are now 946 cases in workers, with 798 that have now recovered. There have also been 566 cases among workers at the JBS plant in Brooks. Of these, 434 have now recovered. Finally, at Harmony Beef, there are 38 confirmed cases, including 12 who have now recovered. I want to be clear that we are monitoring each of these outbreaks very closely, working with operators to contain the spread, and making sure that all public health measures are being enforced and taken seriously. We are also making sure to support workers to contain the spread in all settings, as a focus on just a single work site will not stop an outbreak. I know many are concerned about these outbreaks and the reopening of Cargill on May 4th. I'd like to briefly go over the measures that have been implemented to date to protect the health and safety of workers going forward. Alberta Health Services and Occupational Health and Safety are both visiting each outbreak site regularly to ensure control measures are implemented and to provide ongoing advice and support. All meat processing facilities in Alberta with outbreaks underway have implemented safety controls that meet requirements identified by AHS, the Canadian Food Inspection Agency, Occupational Health and Safety legislation, and my orders. In fact, all food processing facilities in Alberta are expected to have implemented these measures. These controls are tailored in the facilities to address the needs of the situation and operation. For example, controls in place include staff temperature checks and symptom checks before entering the facility, face masks and other personal protective equipment provided to employees and worn at all times, enhanced cleaning and sanitizing practices, staggered breaks and shift flexibility to prevent gatherings, installing additional sinks where needed to ensure that hand washing can be done while distance is maintained, and increasing distance between employees to ensure 2 meters of separation. I have received assurance from Alberta Health Services and Occupational Health and Safety on site that these controls are in place and they meet the requirements outlined by public health orders. In addition, Alberta Health Services has conducted 3 inspections at Cargill, 4 at JBS, and 2 at Harmony Beef. I have confidence in my public health colleagues who are doing this work. We will continue to communicate with operators and affected staff at these sites. The Alberta government has hosted a telephone town hall for those affected by the Cargill outbreak to respond to concerns and questions from workers, employers, and the broader community. AHS has also hosted virtual town halls for employees, providing information in multiple languages. I know there are many questions as to what led to such significant outbreaks. I have been told that investigations into Cargill and JBS are now being conducted by Occupational Health and Safety. This will include investigations of any potential non-compliance that may have affected the health and safety of workers at the facility. Complex investigations such as this one can take a significant amount of time to complete. I've been assured that more information will be shared as the situation evolves. What I can say is that whenever an exposure occurs in any setting, new cases can be seen for up to 2 weeks after that exposure, even if all outbreak measures are implemented. We also know that transmission can happen in multiple settings, worksite as well as off the worksite. Testing is essential to managing outbreaks. To help prevent the spread in the communities themselves, we have established assessment centres for staff and community members in both Brooks and High River. Testing is being offered to all workers in outbreaks, including those without symptoms. I want to emphasize that the health and safety of these workers and all Albertans remains our first priority. If any worker feels like their safety concerns are not being addressed by their employer, I encourage them to contact the Occupational Health and Safety Contact Centre. I know that Albertans want these outbreaks to be over immediately. If I had the power to do so, I would make that happen. Unfortunately, this virus is like a forest fire. Once it has started to spread, there are no simple or immediate ways to put it out. It takes time and hard work and proven practices that slow the spread. We are making progress. We will win this fight. We have implemented lessons learned at Cargill, at other work sites that are experiencing outbreaks, to be sure that every effort is made to prevent spread. As we look forward to resuming normal activities later this May, it is critical that Albertans, including workers, continue to maintain physical distancing, practice good hand hygiene and sanitizing measures, both at the work site as well as outside the work site. Employers are required to put measures in place to protect their employees from spread. As always, we are all in this together, and everyone's work counts. Thank you, and I'm happy to take questions.
All right, we'll now go to the phone. In addition to Dr. Hinshaw, we also have Dr. Mark Jaffe, Vice President and Medical Director with AHS. Operator, could you please put through the first question?
First is James Keller with the Globe and Mail. Go ahead, James.
Hi there. Can we talk a bit about phase one? The date was, as early as May 14th. We're basically a week out. What do we know about whether we'll be ready then? How close to that date will we be making the decisions? A game time decision? Just tell me a bit about where we are and what the next week will look like in terms of actually making a call.
Sure. So we're closely monitoring our indicators, which include the number of people in hospital for COVID-19, the number of people in ICU, and the number of new cases. So today, with respect to the number of people hospitalized, we have 82 people in hospital, with 19 of those admitted to ICU. So we are tracking a little bit under our high water mark on those numbers, which was happening last week. With respect to total number of new cases, we did see 70 new cases today, which again is less than we had been seeing over the last week. We are watching that closely, and some of that does relate to testing campaigns that are being done in different settings, particularly in outbreak settings. And so those are the kinds of numbers that we're watching really closely to see whether or not the opening measures that we're looking at for stage one might be appropriate to do so next week. And so those are the kinds of things that will inform a recommendation that my team and I will put together and bring forward to the Emergency Management Cabinet Committee that brings into consideration both all of those metrics as well as thinking about the different kinds of activities that are in stage one and how those things can be done safely. We are encouraging all workplaces and businesses across the province to work with their provincial associations to adapt the workplace guidance, the document that's on the alberta.ca website, because businesses and different industry settings, different sectors, will know their operations much better than we will. And so that guidance, that broadly applicable guidance that's on our website should be used to create industry-specific guidance that then can be reviewed, and we can make sure that those sectors that are ready to go with those kinds of safe opening guidelines are poised to do so when the numbers tell us that it's safe to do so.
Operator, could you please put through the next question?
Next is Laurent Perreault with Radio Canada. Go ahead, please.
Yes, I was wondering whether you had a good idea now about what happened during Easter. Do we know that people indeed stayed home and followed your guideline, or do you have any indications that people may have been out a bit more than you wish?
That's a good question, and certainly nothing was reported to me with respect to any kind of a spike in, for example, complaints that were reported to the Alberta Health Services Environmental Public Health Team about any kind of increased volume of people out and about or gathering in larger groups. So I'm not sure whether or not there was a concern. We didn't necessarily see a spike in new cases that was noticeable after Easter on a broad base across the province, but ultimately I don't have a specific way of knowing whether or not that happened, but not to my knowledge.
Operator, could you please put through the next question?
Next is Michael King with Global News. Go ahead, Michael.
Hi there, Dr. Hinshaw. We know that Edmonton's numbers have basically remained unchanged for the last 5 days, but Calgary and other zones continue to see a rise. What's the biggest factor when it comes to Calgary versus Edmonton now that we've gone past kind of the travelers and even the outbreaks are starting to level off? And how will that impact the phase one or even further down the road, phase two, phase three approach for reopening?
So the difference between Calgary and Edmonton, I think, has changed over time. We've talked before about the fact that early on, as you mentioned, there was that travel difference with more travelers coming back to Calgary. We have then seen some of these large outbreaks, particularly the Cargill outbreak, impacting the numbers in Calgary. And then more recently, as we've seen some of those numbers from the Cargill outbreak start to taper off, that's less of a driver, but some of that is still the remaining secondary spread, or sometimes a third generation of spread, sometimes from those interconnected cases that we saw in that outbreak. The other cases over and above that, we are working with our epidemiology team to see if there's a particular pattern that we can flag to see where people may have been acquiring the disease. And so far, we haven't seen a particular single factor that's driving it. We continue to do that work to investigate the records of people in Calgary, especially those who are not contacts of known cases. But so far, we haven't identified a significant commonality. But again, we continue to pursue that to see if there is a pattern that we can uncover. With respect to the question about going forward and regional variation, I think that's something that we would have to be discussing with the municipalities that have more cases to try to understand what is happening, and that we would need to be informed by our epidemiology. And that work, again, is underway with respect to that assessment. So no decisions have been made yet about what that, if any, regional decision-making would happen with the relaunch next week.
Operator, could you please put through the next question?
Next is Kevin Nimick with CTV. Go ahead, Kevin.
Hi, Dr. Hinshaw. As you have said, we've seen several days in a row with fewer cases reported than we were seeing over the last couple weeks. Does that mean we're flattening the curve? And what is our target in terms of an infection rate?
So we have, I think, flattened the curve in general across the province, and some locations are more flat than others. We did see steep increases related to some of the outbreaks that have been happening in Calgary and South Zone, and some of that transmission is tapering off. I will say that last week we were in the middle of doing a lot of enhanced testing in outbreak settings, and that included testing of employees at work sites where outbreaks were happening. It included testing in the community of Brooks, where there are a significant number of cases, and offering testing to people who were even asymptomatic in that community, given the high number of cases. And so I would say that last week, many of the cases that we were seeing were driven by that expanded testing and that focus on outbreak settings. So I think we can take the reduction in the number of cases cautiously as good news. We certainly want to see that. But I think we're still watching really closely because we know that depending on the setting, even a few cases can spread quickly to others if there are groups gathered together where prevention measures are not being taken. And so we continue to have that message of asking people to stay safe, follow the prevention measures that we've talked about before. With respect to what kinds of numbers we're looking at, we really need to be seeing that our cases are stable or declining. Our hospitalizations particularly are stable or declining. We know that there is a balance between supporting Albertans' health by preventing the spread of the virus and supporting Albertans' health by making sure that the other factors that Albertans need for a whole person healthiness, which is social connection, employment, recreation, that we need to be ensuring that we're thinking about Albertans' health holistically and bringing those two pieces together. So we will continue to see some cases. We may even see a slight rise in cases as we cautiously move into our relaunch phase. But what we don't want to see is any kind of a steep increase. We don't want to see an increase of greater than 5% of our hospitalizations. We want to see that staying level, and ideally, as much as we can, try to make that flat and or declining over time.
Operator, could you please put through the next question?
Next is Jason Herring with the Calgary Herald. Go ahead, Jason.
Hi, Dr. Hinshaw. Given the dramatic community spread that we're seeing in Brooks, is there any chance that there will be a delay in reopening or relaxing restrictions in that community beyond the tentative May 14th date or whenever phase 1 happens? As well, I'm wondering why we didn't hear an update on Harmony Beef for more than a month with these press conferences, while nearly 36 more cases were confirmed during that period.
So with respect to Brooks, the framework for regional decision-making is being worked out. So certainly there are certain locations in the province where there are more cases than others, but there have been no final decisions about what kind of a process we would use to determine whether or not in a particular region we would need to be slower at reopening than others. So that discussion is underway. With respect to Harmony, so there was a single case at Harmony that occurred, I believe it was in March, and that single case did not spread. There was containment measures that were put in place, and then there were a few cases that were reported. I'm trying to think when I first learned of them. We'd have to get back to you on the date. But the total number of cases that were reported was relatively small up until just last week, when there were additional cases identified and then outbreak measures were put in place with additional testing. And so the bulk of the cases that have been identified were identified last week, which is when we started sharing information about Harmony in these press conferences.
Operator, could you please through the next question?
Jeff Slack with 660 News. Go ahead, Jeff.
Hi there. Just on phase 1, restaurants aren't sure how they'll be able to maintain physical distancing, and they want to know, is it safe enough to open their business without strict physical distancing measures, or are they expected to maintain it? I was wondering if you could give some advice on some of those businesses who do work in smaller settings.
Sure. So certainly there are businesses in stage 1. We've had that question about hairstylists as well as now restaurants. And we know that the distancing requirements are challenging to maintain, for example, in a restaurant between a server and patrons. So my understanding is that the restaurant associations have been looking at the guidance documents that we've put out on the website and are considering what kinds of adjustments they could make, or I should say how those guidance documents can be incorporated into the context of restaurants. And there are certain kinds of additional measures that can be taken when distancing can't be maintained, such as wearing masks. And those are the kinds of things that we're definitely interested in talking to the restaurant associations about. And it's my understanding that we will be receiving some documents from them as they've thought through how the guidance we've put out would be applied to settings to make sure that patrons and staff are safe. So again, that work is currently underway.
All right, we've got time for 3 more questions. Operator, could you put through the first one, please?
Next is Julia Wong with Global News. Go ahead, Julia.
Hi, Dr. Hinshaw. Other countries have discovered COVID-19 emerged sooner than previously thought. I understand the province previously tested some community influenza samples from its surveillance network. How far back did that testing go, and what else is being done to look for early incidences of the virus? And have there been any cases that predate March 5th?
So the testing for our influenza network samples started in March. So we haven't tested samples that were taken prior to that. And one of the things we're doing certainly is looking at the possibility of serology testing once there are serology kits that are validated and shown to perform well. We're looking at different options for sampling Albertans, some of whom perhaps have never been shown to have COVID-19 through a swab, but who may potentially have had infection in the past and not been aware of it. So those test studies are being looked at and going through ethics approval to make sure that we're framing them in a way that's appropriate and that we're thinking about who we would be offering those tests to. And that may help give us some insight into whether or not people were in fact infected prior to the first case that we knew about, which happened in March.
Operator, could you please put through the next question?
Next is David Staples with the Edmonton Journal. Go ahead, David.
Hi, Dr. Hinshaw. So many parents and teachers are worried about the health and educational impacts of closing the schools on students. So I know there's many factors that you're looking at in terms of schools, and I'm wondering what you think of that factor and what other factors, what are the big factors you're looking at in terms of reopening the schools in September?
So exactly as you say, and as I was mentioning earlier, we know that catching COVID is only one potential health impact, and that there's other health impacts, particularly students who rely on school as a place where they, sometimes have access to services that they're hard to access otherwise. It's a place where they can be with friends, get support from teachers, and obviously education is a critical component of students' health. So we don't take decisions lightly about when we would be reopening schools, but we also know that because especially young children, it can be difficult for them to maintain distancing. School reduce the incidence of transmission of disease within that setting, keeping the students, keeping the staff and teachers safe, and also the families that those students go home to. And so that...
Could you please put through our final question?
Jennifer Lee with CBC News. Go ahead, Jennifer.
Hi, Dr. Hinshaw. My question's about continuing care. And as you know, there are calls for, I guess, the province to take stronger measures to address the pandemic in continuing care. Some calls coming from seniors advocates, some coming from unions. One call is for the province to step in and do inspections or investigations in all continuing care facilities to make sure that they're following guidelines for pandemics. There's also a call for AHS to step in earlier and take over operations earlier if there are outbreaks or violations. I guess, is that something that you're considering? And if not, why not?
Sure. So what I'll say with respect to the audits is we do have a team in the Ministry of Health that does audits and compliance inspections of continuing care facilities. And they've actually already started a proactive audit inspection plan to make sure that they are getting out to facilities, starting with those facilities that have outbreaks and then moving into the facilities that do not, and doing the proactive inspections to make sure that all of the measures laid out in the continuing care orders are being implemented and everything that can be done to protect residents and staff is in place. So yes, that has already begun and is underway. With respect to what more can be done to protect the individuals living in these environments, and knowing that these are environments where people are very sensitive and at high risk of severe outcomes, We have been working regularly with operators of these facilities. In fact, I just met with a group of them this morning, and I have another meeting with a group of them next week, because what we want to do is make sure that we are taking the input of the operators, of families, of residents, to understand how we can get the best outcome for people living in these facilities, how we can protect them from the spread of virus, but also how we can ensure that the other things that they need to stay healthy, that we can try to provide that for them in the safest way possible. What I think we need to recall is that this virus will be with us for many, many months to come. And so a measure such as having absolutely no visitors at all in a facility for no reason at all, that might be something we could put up with for a few weeks, would be much harder to manage for, say, 8 months. And again, we need to plan ahead and know that this virus is going to be with us. So we have to protect residents from infection at the same time as supporting them to have a quality of life and making sure that we're working on that balance in conjunction with residents, with families, with operators. And I know that operators are doing their best in a challenging time with a lot of new requirements. And so I do ask families and friends of people who are living in these facilities to work with the operators and to remember that we have just made some changes to our visitation requirements that allow more of that kind of visiting to happen. But I would ask those family and friends of people in continuing care facilities to remember that, again, there are always these trade-offs. So the more people that go into facilities, the more risk of that potential introduction. Yet when we have no visitors, it also increases the risk of isolation, loneliness, and some challenges on the other side for residents who are in there. So again, it is about balance. It is about finding the path forward that seeks to achieve safety and wellness for those residents and those staff. And we're on that path with the operators, with the residents, and with their families.
Thank you all for joining us. We will provide another update tomorrow afternoon.